What does science say about the COVID-19 vaccine for children under the age of 12? We have the inside scoop behind the regional effort to find out the safety and efficacy of that age group. I'm Christa Dubill, and great to have you here for the Blue KC COVID-19 Vaccine Safe series. The woman in charge of the Pfizer clinical trial on children 6 months of age to 11 years old joins us now. Dr. Barbara Pahud is the Director of Pediatric Infectious Diseases Research at Children's Mercy, Kansas City. And we also have Lynette Droege of Kansas City, Kansas, along with her 8-year-old twins, Levon and Carolina, who are participating in the trial. Thank you all for being here. First, to Dr. Pahud, please share a few facts about how the trial works and its purpose.
Sure. So we all know Pfizer has already had that vaccine approved for children 12 and older. And the next step is doing what we've already done with adults, with teenagers, which is finish the clinical trials with the children less than 12. And we're going all the way down to 6 months of age. Once we find the participants, like we did them, they come in, they get 2 shots separated 21 days apart, and then we follow them for safety and to evaluate how they're doing with the vaccine. Then all that data can get submitted to the FDA for hopefully an emergency use authorization.
And there aren't very many of them taking part in this sort of research. You're one of how many?
Well, the dose finding study, we were one of 6.
Okay.
And now that we are doing the large clinical trial, there's a lot more sites across the country.
Okay. All right, good. And I know that you worked specifically to find a very diverse group to include in that. Why is that so important?
It's traditionally difficult to find a diverse group of participants for clinical trials. It's easier to find basically participants that are able to drive themselves to the clinical trial, that understand the science, that are familiar with the science, and going to diverse populations who may not understand the consent process, may not speak the language, or are not trusting of the medical research, which rightly so many people are not, takes more time and energy.
And I want to get to Lynette and Carolina and Levon in just a minute, but tell me just a little bit from your perspective about the importance of their involvement in the study.
Well, I mean, we wouldn't be able to do any of this without the kids volunteering to do this. So in my mind, every single parent that has considered doing this is a hero in my mind. And then the children doing it are superheroes. Not just heroes, superheroes.
All right, hero mom, tell me what your thoughts were when it came time to figure out, how did you learn about the study? How did you decide to be a part of it? And what did you do on your end?
When they rolled out the adult one, you know, you start thinking, okay, well, what about my kids? Like, when is that going to happen? And you start hearing, you know, Children's Mercy is, you know, looking for people that parents that could be interested, because at that time, they didn't even know if they were going to get it, from what I understand. So they just had some information that you could log on. So I logged on. I actually have 4 children, and tried to enroll all 4 of them to it. And then we got the phone call to accept them. But for me, I want to be safe, but for a parent, you want your children, that's what your ultimate goal is, to have them safe.
Tell me why you guys wanted to be in part of this. And Levon, you start with you. Why did you want to do this?
So I could be a superhero.
So, you know, there is a reason for that. Carolina, what about you?
I wanted to help kids under 12 and in between 6 months to help them get the vaccine so this can all be over.
Levon, what did you have to do to be a part of the study? What have you had to do?
I had to get 2 injections.
Where was it, in your arm?
They have to do.
My shoulder. They had a blood test. Well, only one blood test.
Okay.
My heel.
Yeah. And was any part of it scary for you?
No.
Oh, you were super brave?
Yeah, I've done a blood test before.
Oh, you have? Okay. So do you guys feel better knowing that you're a part of helping to find out if this is good for all kids?
Yeah. Yeah.
Okay. So Lynette, did you have any fears?
No, because I trust that if they're at the point where they're asking for volunteers, that it's as safe as when we did it. And my kids are very healthy. I'm lucky to have healthy children. So they're like the really good candidates for it. So we're lucky to have children to be able to, and we talked to them about it to see if they were interested. So,
any early signs of side effects at all in any of the kids in your research?
Yes, and that's actually why we do the studies, because side effects happen with everything. Taking Tylenol can give you side effect. Driving a car, you can get into a car accident. The question is, which ones are they? Are they tolerable? Is it something that we want to know about ahead of time so we can mediate it? That's why we did the dose finding studies first. when you give a big dose to a child, maybe they have, for example, too much fever. So then maybe you lower the dose to decrease the fever, but then you need to see, does that mean the vaccine is still effective, yes or no? So you find the Goldilocks effect, the right dose, which is not too much, not too little, just right, that gives you a profile of side effects that is acceptable to parents, but that also gives you an adequate immune response. So the usual things, right? Did you guys have a pain in your arm after you got the vaccine?
Yes.
A little bit of pain, a little bit sometimes of redness, and some kids might be a little bit tired after the vaccine, similar to what we know from all other vaccines. Sometimes some children may develop fever, but nothing that is more scary than actually having your child in the hospital with COVID.
Do the side effects you're finding impact the safety of the vaccination?
Yes, so if we were to find side effects that are not something we think are acceptable to the public, to ourselves, then the vaccine wouldn't be submitted for emergency use authorization.
So how then do you determine if it's safe?
We collect data from children across the country, and we gather the data, and that's why we have what we call placebo-controlled clinical trials. So out of 3 kids enrolled in the study, 2 will get the vaccine and 1 will not. So let's say that the kid that didn't get the vaccine, we wouldn't know. It's a blinded study. But let's say that that kid develops a fever because they got a influenza. We need to compare the data across both the control and the placebo to see if what's happening is happening more often among those that got the vaccine versus those that didn't, to be able to see if the vaccine is safe or not. We need to compare to the background rate of things that still happen to children in life.
Right. And where you are now in your research, do you have any early feelings about the safety and efficacy of this vaccination for children?
Yes, I think the vaccination is going well. The biggest signal we have so far is what you all know, which is the signal we found in children older than 12 and adults all the way up to 30, where they may have some myopericarditis, slight inflammation around the heart that is very easily manageable. So we noticed that once the vaccine was released into the public because it's a very, very rare side effect. So if you have a side effect that happens in 1 in a million, for example, and you do a clinical trial with 100,000 people, 60,000 people, you're not going to find it. You can only find those very rare side effects once the vaccine has been given to more people. So that's what we're seeing right now, but with the pediatric population that we're studying, everything is happening as expected.
And what do you say to the people who might hear that there are people experiencing the rare side effects of this heart effect? What do you say to them about whether or not that might scare them enough to not get the vaccination?
It sounds like a very scary side effect, of course, but what we have seen, at least in the children that have developed it, is that they get better. Pretty much once you give them a little anti-inflammatory, they go home and they recover immediately. So it's a side effect that is manageable, it's tolerable, and compared to the side effect and potential complications of COVID, it is something that we still believe, again, that risk-benefit ratio that we were discussing earlier, that it's definitely worth it. And also, you can have complications in your heart as a child due to COVID that are much more severe and not as manageable as this one. So again, when you compare what could happen to me from a vaccine versus what could happen to me if I get COVID, the problems with your heart are much larger if you actually catch COVID than the potential treatable, manageable side effect from the vaccine.
That you said was rare. So
very rare.
A lot of people with questions, as you might imagine. So, Levon, I'm going to have a question, very serious question for you. How's it going in the study?
It's going great.
It's going great. And do you feel good? Have you had any sickness? No? Did your arm hurt when you got your shot?
Yes.
It did a little bit? Did it hurt when you got the shot or after the shot?
A couple seconds after the shot.
Yeah. And what about you, Carolina?
So the study's going great, but it did hurt after I got the shot.
But not too bad, right? Just a little bit?
I mean, it hurt for a few days.
A few days, it was a little sore. And Lynette, I'm assuming you're vaccinated as well.
Yes.
And so what do you watch for different things, knowing your kids are kind of going through this research and being a part of studies, whether to see if this is safe for other children?
So we have certain things that we're supposed to look out for. So, I've been looking out for those things, and then we had to every day. We had to do like an e-diary, so we would let them know, yes, they had this, no, they didn't, and we had to talk about if it was mild, moderate, or severe. So we had a lot of fun figuring out what those words meant and how, you know, that worked for us. And then if we gave them medication, you know, their arm was really hurting and they wanted medicine, we'd let them know that we gave them medication for that.
All right, superheroes, Levon and Carolina, thank you for coming today. Lynette, thank you for being here. Dr. Pahud, I know I'll be following your research further and seeing what the outcomes are and how this develops over time. So thank you very much. I want to thank all of our guests for being a part of the COVID-19 Vaccine Safe series. To find out where you can get the vaccine, visit the website vaccinefinder.org. And for more helpful resources, go to bluekc.com.